हेलो एंड वेरी गुड इवनिंग एवरीवन। आप सब लोग का बहुत बहुत स्वागत है। हाउ आर यू ऑल डूइंग? गुड इवनिंग नीलाक्षी, गुड इवनिंग प्राची। सो एवरीवन, very good evening. Today we are going to discuss these important topics, that is communicable disease, non-communicable disease, and few national health programs. And I hope I'm audible and visible to everyone. I hope it's all fine. I hope it's all fine. चलो, गुड। सो चलो जी, आज का है टॉपिक इज कम्युनिकेबल डिजीज, नॉन कम्युनिकेबल डिजीज एंड नेशनल हेल्थ प्रोग्राम. सो अ वेरी क्विक रिव्यू अबाउट ऑल दीज थिंग्स. A 7-year-old boy is a known household contact for a patient of drug-sensitive tuberculosis under treatment from the primary health center. The child denies for 6 months of TB prophylaxis. What is the next best alternate regime? What is the next best alternate regime? So for TB prophylaxis, there are 2-3 regimes which are given by Government of India. So you have to decide like which is the first one, which is the second, and which is the third one. So what do you think is the best answer in this case? Yeah, so it is, yeah. National health programs, they are usually straightforward questions, beta factual questions hote hain, and you don't need to put too much brain on these type of questions, but yeah, you should be knowing at least how to solve them. So बिल्कुल ठीक है जी, बिल्कुल ठीक है, everybody is correct. So as we talk about the prophylaxis of tuberculosis, beta, the prophylaxis of tuberculosis, the most common regime or the best regime which we have been using since many years is 6 months of isoniazid. In case 6 months of isoniazid is not there, we have a better regime which is a newer regime. It is 3 months of HNP. HNP stands for isoniazid and P stands for rifapentin. P stands for rifapentin. Okay, so 3 months of HNP, it is a slightly better regime, and it is given as weekly doses. These are weekly doses, and this is 3 months of HNP. On the other hand, there is a newer regime which had been launched recently, update in 2024. This is 1 month of HNP, that is isoniazid plus rifapentin, and this is total daily dose. So total we are giving 28 doses in this. In the 3 months of HNP, these are 12 doses, and this is given as weekly tablets. Please note, wherever for how much time we are giving isoniazid, we also need to give the pyridoxine tablets alongside. So this is the regime. In case you want to remember that who is getting what all regimes, you can remember over here that the target population in case of people living with HIV, so all the PL-HIVs, we have to give them tuberculosis prophylaxis alongside household contacts less than 5 years, infant less than 12 months in contact with active tuberculosis. You can give 6 months of isoniazid or 3 months of isoniazid and rifapentin. So please note, this can be given only in people age more than 2 years, only in age more than 2 years. So household contacts 5 years and above, we can give same answer, 3 months of isoniazid rifapentin or 6 months of isoniazid. There is a new regime. The newer regime is 1 month of HNP. It is given on trial basis. It is given only in persons living with HIV. So it is not given in general population. It is only given with persons with HIV. Next question, the standard dose for prevention of neuropathy in tuberculosis treatment is. So what is the standard dose of treatment or prevention, not treatment, prevention of neuropathy in tuberculosis? Just now we discussed this question. Very simple, straightforward question. The standard dose for prevention of neuropathy in tuberculosis management. What is the best answer? calcium 500, vitamin B6, vitamin D, and calcium 500 or vitamin B6. This is vitamin B6. This should have been vitamin B6. Let me just edit this. Vitamin B6. So what do you think is the best answer? What do you think is the best answer? Now what do you think is the best answer? हाँ, थोड़ा तो कंफ्यूजन होना चाहिए ना, अदरवाइज तो इशू रहेगा। सर एक दिन में फुल पीएसएम करवा दीजिए, वो करेंगे यार। आई थिंक आई एम प्लानिंग फॉर अ सेशन मे बी सम टाइम सून। अभी आई एम नॉट वेरी श्योर, बट नेक्स्ट सेशन वुड बी डिसेंटली। अभी 3 भाग में तो हमने डिवाइड कर लिया ना, कम्युनिकेबल, नॉन कम्युनिकेबल, नेशनल हेल्थ प्रोग्राम, mother child health, everything like demography, family planning, everything we have done. And बस एक सेशन और होगा, that is epidemiology, biostats and including the nutrition, environment, ये सब टॉपिक्स कर लेंगे। and 3 सेशंस में पूरी कम्युनिटी मेडिसिन आपकी होगी। So that's what my main goal is. So I still think B, absolutely correct, beta. The dose for pyridoxine, you need to remember, it is given to all adults at the rate of 25. But यहाँ पे I would like to caution over here, there can be a question that what is the dose for adult and person living with HIV. Generally for all adults we give at the dose of 25 milligram. But in case a person is with HIV, in PLHIVs, the dose for pyridoxine, it will be 50 milligrams a day, and for children it is 10 milligrams a day. This is for the prevention of neuropathy, which is isoniazid induced neuropathy, and that is what is the dose of pyridoxine, vitamin B6. So please note, it is not 100 micrograms, it is 25 milligrams or 50 milligrams. Coming to the next MCQ, all of the following are correct regarding lymphatic filariasis except serology RK39 is done for filariasis antigen. DEC provocation is alternate clinical investigation. Membrane filtration is most common, and ELISA is used for filarial surveillance. What do you think? What do you think is the best answer? Which of the following is incorrect? Which of the following is incorrect? So Ravi Mandal says A, D, A. Absolutely correct, beta. Obviously, it's a very direct MCQ. Please note that lymphatic filariasis, it is important topic for your exam. Lymphatic filariasis is a 5-star topic. I don't know what question they will ask, but there is a very high chances that you will get a question on lymphatic filariasis. There is a pretty high chance there will be a question on lymphatic filariasis. 2-4 बातें about lymphatic filariasis. Regarding the investigation, beta, what is the investigation of choice? It is peripheral blood film. It is peripheral blood film, that is the investigation of choice. Which is the most sensitive method? Most sensitive method, that is membrane filtration concentration method. And lastly, which is the clinical investigation? Because peripheral blood film, it has to be done from 10 p.m. till 2 a.m. because at this time there is the maximum activity of the parasite or the worms inside the blood. So peripheral blood film is done in the midnight time. The clinical investigation, it is DEC provocation test. DEC provocation test. After giving DEC, we will again do the peripheral blood film. MCQ which can be asked is, you will do peripheral blood film after how much time of giving 100 milligram of DEC? We will do it within 30 minutes. Even you can do it within 10 to 15 minutes, but 30 minutes is the ideal answer or the best answer. You can do it anytime within 30 minutes. So not anytime like you can't give DEC and immediately within 1 minute, but generally around 30 minutes is the time. And it can be even done after 10 to 15 minutes. So that is regarding the investigation. What is the treatment? The treatment is 12 doses. We give 12 doses of DEC. We give 12 doses of DEC. not DCE. We give 12 doses of DEC, diethyl carbamazine. And what is the prophylaxis? Beta, the prophylaxis has been changed for lymphatic filariasis. That is, we are giving biannual. Biannual means 2 times a year. Biannual dose of IDA. IDA stands for ivermectin. D stands for DEC and A stands for albendazole. A stands for albendazole. So we are giving ivermectin, DEC, albendazole. This has to be given biannually. It is usually mixed with or merged with the National Deworming Days. When do we have is the National Deworming Days? Any idea? When do we have the National Deworming Days? The National Deworming Days are on 10th of February and 10th of August every year. And these are the National Deworming Days, that is biannual MDA. A few points about Kala Azar, beta. A few points about leishmaniasis, Kala Azar. Kala Azar. The investigation of choice, that is RK39. The drug of choice, that is liposomal amphotericin B, and the alternate drug we can give is miltefosine plus paramomycin. We can give miltefosine plus paramomycin. Kala Azar, it is transmitted by sandfly. Sandfly, what is the best insecticide for the sandfly? Insecticide that is used is synthetic pyrethroids. Synthetic pyrethroids is the best insecticide, and that is all. Sandfly is a nocturnal biter. It is a nocturnal biter. It causes a very painful bite. That is a few points about sandfly. Let us go to the next MCQ. Just have a look at this question. Lalita, yes, we still use mass drug administration. Yes, this is what we call as MDA, beta. This is what we call as MDA, mass drug administration. It is given to all people whose age is more than 5 years in the lymphatic filariasis endemic areas. Coming back to this question, what do you think is the correct answer? It is option D. This has been asked multiple times in your exam. So option B. Okay, we forgot the answer of the previous question. All of the following are correct for lymphatic filariasis except. So you wanted to find the wrong one. DC was alternate test. Yes, this is true. Membrane filtration is most sensitive is true. ELISA test, it is done for filariasis surveillance. Yes, this is also true. ELISA test is done for filariasis surveillance, that is transmission assessment survey. It is done for transmission assessment survey. Transmission assessment surveys, and that is what we do using ELISA test. So serological RK39 is screening for filariasis antigen. It is wrong. It is used for leishmaniasis. This is the false option. Option A is wrong. So coming to this question, but sir, in northeastern states we should give artemether lumefantrine. Please explain. So most of you are going with option B. Okay, very nice. Yeah, Holla Bolla says C, D, B. Okay, a 32-year-old farmer from Bihar. Okay, 32-year-old farmer from Bihar presents with to the CHC with complaint of high-grade fever with chills and rigor. The peripheral slide examined shows normal size RBCs with multiple falciparum parasite inside. So this falciparum, you have to study this from microbiology. It is a 10-star MCQ. What is the microbiological aspects about Plasmodium falciparum, vivax, how to identify, headphone sign, and you have Morer's dot, Schaffner's dot. Vivax will show Schaffner's dot, falciparum will show Morer's dot, young RBC, small RBC, big RBC, normal size RBC. So all these, please study from microbiology. It is very, 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 very important. Sometimes they will give you image based questions, sometimes they will give you a clinical scenario, sometimes they will give you written format of what is seen in the slide examination or the smear examination, and then you have to identify what type of malaria. Well, over here the MCQ directly says it is a Plasmodium falciparum, and the patient should be registered under the national program and started on which of the following regime: chloroquine for 3 days and primaquine for 14 days, artemisinin based combination therapy and primaquine for 14 days, artemether lumefantrine for 3 days, artemisinin based combination therapy and primaquine as single dose. What do you think is the best answer? So this is, we are talking about Plasmodium falciparum, right? So please note that the treatment regime is for malaria. I have consolidated in this table for you guys. Beta, try to understand there could be two types of malaria. We can have a Plasmodium vivax or we can have a falciparum. For vivax, the drug of choice is chloroquine with primaquine for 14 days. Chloroquine is to be given for 3 days total. This is given total dose is 25 milligram. This is given in 3 divided doses. And then we also have primaquine. It is given at the dose of 0.25 milligram per kg body weight for 14 days. In case the patient comes with falciparum, now you have to see whether the patient is from northeastern states or any other states. Northeastern states, we give artemether plus lumefantrine, and primaquine is given on day 2 single dose. In all other states, it is artesunate, sulfadoxine, pyrimethamine plus primaquine as single dose on day 2. Okay. In case of mixed infection, we give the ACT, that is the falciparum, and we give primaquine for 14 days. This is the treatment regime you have to memorize. So now it is very simple. It is common sense answer that this patient is coming from Bihar. Bihar is not a northeastern state, hola bola. Please note, Bihar is in the eastern part of India, but it is not the northeastern state. Northeastern states कौन सी होती हैं बेटा? Assam, Meghalaya, Manipur, Mizoram, Tripura, Arunachal Pradesh. All these are northeastern states. And therefore this patient is from Bihar, and therefore the correct answer over here is we are going to give artemisinin based combination therapy and primaquine as single dose. Which of the following categories is not a part of the HIV serosurveillance under NACP, Ministry of Health and Family Welfare? What do you think is the best answer? Which of the following categories is not a part of HIV surveillance? Option C, truck drivers. Option C. तुम लोग मतलब option C and D, right? Option C. Okay. So, did you ever read the question also? यार जहाँ ट्रक ड्राइवर दिखा वहाँ मार्क कर दिया. क्वेश्चन पढ़ा भी है जिन लोगों ने आंसर किया है. Did you even read the MCQ? Which of the following categories is not a part of the HIV serosurveillance under NACP? इतने टफ ऑप्शन. मतलब छूटते ही देखते ही everybody was like C. ट्रक ड्राइवर दिखा नहीं तो लगाया नहीं, ट्रक ड्राइवर का मार्क किया नहीं तुमने. सो ट्रक ड्राइवर इज योर फेवरेट. सवाल जो मर्जी आए, हमने तो ट्रक ड्राइवर मार्क करना है. आपका ये हो गया था. सो इट्स अ वेरी सिंपल क्वेश्चन बेटा. आई नो दैट अभी एम्स एग्जाम में दे आस्क दिस क्वेश्चन अगेन, and they ask that which of the following is not a part of the high risk categories. Truck driver is not a high risk category, but मैंने तो वो क्वेश्चन ही नहीं पूछा. Which of the following is not a part of the HIV serosurveillance? You already know HIV serosurveillance is divided into 3 groups. We have is the high risk groups, bridge population, and the general population. So high risk groups are female sex workers, male having sex with males, intravenous drug abusers, and transgender population. Single male migrants and truck drivers, these are bridge population, they are not high risk groups. And last is the antenatal care females, that is the pregnant females, they are part of the general population category. So, which of the following is not a part? Antenatal, yes, it is a part. IV drug users, these are high risk groups. Truck drivers as bridge population. So, which of the following is not a part? Recurrent TB cases are not a part of HIV serosurveillance. Sir, please explain serosurveillance versus sentinel surveillance. Sentinel surveillance, beta. Sentinel surveillance, it is to find missing cases. And how do we find the missing cases? By installing or by putting in the RTI, STI clinics. These are the Suraksha clinics. Suraksha clinics, and that is what is sentinel surveillance. Sentinel means the first person who's going to meet you at the door. Okay, and the serosurveillance, it is to find the burden. Serosurveillance, that is serosurveillance, it is to find the burden of HIV. It is to find the burden of HIV. Okay. Right. चलो अगला क्वेश्चन देखते हैं. सो व्हाट इज द बेस्ट आंसर? रिकरेंट टीबी केसेस. प्लीज आई वुड लाइक टू टेल यू विच इज नॉट ए पार्ट ऑफ द HIV serosurveillance. Which is not a part of HIV serosurveillance? RTI, STI clinics, TB centers, TB hospitals, TB centers or TB clinics. Then fishermen. Earlier they were included into serosurveillance because we used to find HIV burden in these people also, but now Government of India, they have stopped using these groups as part of the serosurveillance, and they have used these 7 categories. These are the only 7 categories under the serosurveillance. Let us try to solve the next MCQ. What do you think is the best answer? What do you think is the best answer? 40-year-old male presents with 2 hypopigmented and 2 hypoanesthetic lesions on the back. Further investigation, AFB was identified from skin slit smear, so therefore it's a case of leprosy. The patient should be started on which of the following regime? These are only 2 hypopigmented patches. What do you think is the best answer? With only 2 hypopigmented and hypoanesthetic lesions, what do you think is the best answer? 3 drug regime for 6 months or 12 months? Yeah, 3 drug has to be given. But 3 drug for how many months? A or B? Okay. So there are 2 hypopigmented hypoanesthetic lesions. Yes, correct answer, it is given for 12 months. Correct answer, it is given for 12 months. Please note that what is leprosy? Leprosy, again NLEP. It is a 10-star MCQ. We want a leprosy Mukt Bharat by year 2027. We want a leprosy Mukt Bharat by year 2027. So please remember that NLEP, a few guidelines have been changed. Question number 1. What are the clinical features of leprosy? Clinical features of leprosy is hypoanesthetic and hypopigmented. Hypopigmented, let's talk about pigmentation first. So it is hypopigmented or reddish lesion, but the more important thing is with sensory deficit. This sensory deficit has to be there. Next is involvement of peripheral nerves with thickening. With this, with is very important, with loss of sensation or weakness or paralysis. So therefore there has to be some neurological deficit in terms of the sensory deficit, or it could even be a motor deficit. Then the third option is that there has to be Mycobacterium leprosy. identified from the lesions or from the skin sites. Please note, it's a very frequently asked MCQ that do we need all three, any one, or any two? Please note, it is any one of the following. We just need any one of the following. It could even be one hypoanesthetic and hypopigmented lesion without AFB, without any nerve thickening, without anything. Just one hypopigmented hypoanesthetic patch, that is enough to be called as leprosy. So any one has to be there, and then we can, this is the updated definition. This is the updated new definition from 2025 April. We started using this definition. So in case there is 1 to 5 lesions, it is paucibacillary. More than 5, it is multibacillary. So if it is 5 lesions, if the examiner is very cruel, they say 5 lesions were there. So what are you going to mark, pauci or multi? 5 lesions is paucibacillary. More than 5, that is 6 or more than 6. Okay, so this technically it should have been 6 or more than 6. So 6 or more than 6 is multibacillary. No nerve involvement is paucibacillary. Any nerve, one or more nerve involvement is multibacillary, and no AFB found, that is pauci, and AFB found is multibacillary. So what is the treatment regime we give for both of these scenarios? We have to give all the 3 drugs. These 3 drugs, all 3 drugs, these 3 drugs have to be given in case of paucibacillary and multibacillary. Paucibacillary, it is given for 6 months. Multibacillary, it is given for 12 months. So this dose also you need to remember. The dose also you should be remembering better. Rifampicin is given at the dose of 600 milligram. It is given as monthly tablets. Dapsone, it is given at the dose of 100 milligram. It is given as daily tablets. And clofazimine, clofazimine, it is given in 2 doses. It is given at the dose of 300 milligram as monthly dose, and it is also given at the dose of 50 milligram as daily tablets. So this is the dose you have to remember. This is for all adults. The adult dose is this, which is age more than 14 years. For adults, we use this type of the peripheral of the blister pack. This is called as the MDT. What is MDT? MDT stands for multi-drug therapy. So multi-drug therapy, you have to remember multi-drug therapy, MDT, it is giving 3 tablets, 3 different 3 different treatment parts are there: rifampicin, dapsone, and clofazimine. Rifampicin is this long tablets. You can see these are 300 milligram each rifampicin tablets, and then we also have is the clofazimine, which is 100, 3 tablets of clofazimine, and this is clofazimine, rifampicin, and the white color tablet, that is for dapsone. Okay, and how will you differentiate whether this one is for adults or this one is for child? Please note, the pink color is for adults and the brown color is for the child. Why would you say brown color is for the child? Because you can see over here these clofazimine tablets. Can you see that they are alternating? They are not every day. So in a child that is 10 to 14 years, beta, please remember the clofazimine is given on alternate days. So that is just an image based question which you can get and you have to remember. So just remember, this is what is the MDT, and I hope everybody remembers. I didn't have the image over here. We will discuss the images in a separate video section. And this is, I hope you all know Sapna and Meena, right? Sapna and Meena. Who is Sapna? You guys tell me, who is Sapna? What is Sapna and Meena in leprosy? नहीं, क्या मतलब, what is Sapna? क्या Sapna for leprosy? Sapna is a mascot for leprosy awareness. Sapna is a mascot for leprosy awareness. Meena is also a mascot. Meena is by United Nations. Sapna is by Ministry of Health and Family Welfare, India. So Sapna school bag, very nice. Meena with parrot. बिल्कुल ठीक है जी. So as per the latest data, which of the following cancer is the most common cancer related deaths in India? Very good, very good. Sapna, Meena done. Let us go to the next MCQ. As per the latest data, which of the following cancer is the most common cancer-related deaths in India? Lung cancer, lip, oral, mouth cancer, breast cancer, cervical cancer. No, it is not the most common cancer, beta. We are asking about the most common cancer-related deaths. Which cancer is most killing? Okay, some say C, some say A, B, C. Stress वहाँ पे. So when I highlight this point, then your answers change. If I don't highlight this point, then answers will not change. मुदगिल कहता मोस्ट कॉमन कैंसर तो ब्रेस्ट कैंसर है, यहां तक तो ठीक है, बट इट इज मोस्ट कॉमन किलिंग कैंसर. Everybody answering A. Sakshi says D. Solomon A. Sabir A. Varun says mortality also breast cancer is most. Absolutely correct, beta. You can see this graph. This is age standardized cancer mortality. Okay, cancer mortality per 1 lakh population in India in 2020. So you can see that the age standardized cancer mortality, it is highest. It is a whooping number of 13.3 cancer deaths with breast cancer. The next in line, the killing cancer, is cervical cancer. And the third cancer is lip oral cancer, which total is around 10%, 10 to 11%. That is the proportional age standardized cancer mortality. So which is the most common cancer to kill? It is breast cancer. The second most common cancer to kill is cervical cancer, and the third most common cancer to kill is lip oral cavity. You have to differentiate this, beta. That is what my purpose is. अगर मैं आपसे वही पूछूं which everybody is asking, then मेरा क्या यूज हुआ, है ना? So मैं आपको यहाँ पे यही बताना चाह रहा हूँ that everybody will ask you which is the most common cancer in the country. Beta, please note, most common cancer in the country is breast cancer, lip oral cancer, cervical cancer, in this order. But if they ask you most common killing cancer, first is breast cancer, second is cervical cancer, and the third is lip oral cancer. In males, which is the most common cancer? It is lip oral cancer followed by lung cancer. Lung is not the number one. Lip oral cancer followed by the lung cancer followed by the stomach esophagus. I hope you will not forget this. This is pretty important because it has been asked multiple times, and it is slightly, you can say, बच्चे को लगता है अंदर से कि यार lung cancer is the most common. It is not lung is the most common in males. It is lip oral, which is most common in males. In females, I think everybody knows about females. Female में most common cancer is breast cancer, cervical cancer, and ovarian cancer. So I hope you will get this question correct. The most common cancer related deaths in India, it is again same answer, breast cancer. Most common cancer related deaths is same answer, breast cancer. अभी एक स्टूडेंट ने पूछा था सर पिछले क्वेश्चन में वो पॉसी है मल्टी है. बेटा, दिस इज अ केस ऑफ पॉसी बैचलरी बिकॉज you can see over here on further investigation, you can read on further investigation AFB was identified. अगर AFB identify हुआ, so what is this type of leprosy? It is a multibacillary leprosy. Multibacillary leprosy, you give the treatment for 12 months. Sir, is MDA done for scabies, trachoma and lymphatic filariasis? Yes. On a certain level, you can say mass drug administration is given for scabies, because if there is a case of scabies, the whole household needs to be given mass drug administration for prophylaxis. And similarly for trachoma and for lymphatic filariasis, yes, it can be given because it is given at a family level or household level for scabies treatment. Coming to the next MCQ, which of the following is not a suitable intervention for primary prevention of hypertension? What do you think? What do you think is the best answer? Trachoma eliminated? Yes, 2024 trachoma has been eliminated. Childhood trachoma, not general trachoma. विच ऑफ द फॉलोइंग इज नॉट ए सूटेबल इंटरवेंशन. आपने गलत वाला ढूंढना है. विच ऑफ द फॉलोइंग इज नॉट ए सूटेबल इंटरवेंशन. वेरी नाइस. गुड. वेरी गुड, वेरी गुड. वेरी वेरी नाइस. नाउ यू हैव अंडरस्टूड कि जो मैं सर्कल करता हूँ उस पर स्ट्रेस नहीं देना, आपने स्ट्रेस कहीं और देना है. ये समझ में आया है ना. विच ऑफ द फॉलोइंग इज नॉट अ सुटेबल इंटरवेंशन फॉर प्राइमरी प्रिवेंशन ऑफ हाइपरटेंशन. वेरी नाइस. एवरीबडी गॉट इट करेक्ट. दैट प्राइमरी प्रिवेंशन, salt intake of less than 6 grams. Yes, this is the correct answer. Moderate physical activity more than 30 minutes every day. This is correct. Tracking of blood pressure in young children. This is correct. Early diagnosis. That is incorrect. It is a type of secondary prevention. It is not primary prevention. Option D is the best answer to be marked in this. So very nice. Finally didn't fall in the trap. Absolutely. यही तरीका है MCQ को देखने का. Just watch where you can fall. That's all. सो कहाँ कहाँ गिर सकते हो, कहाँ कहाँ धोखे खा सकते हो, वही मेरा काम है आपको बताना. दिस इज द regime. दिस इज द यूरोपियन सोसाइटी ऑफ हाइपरटेंशन एंड कार्डियोलॉजी, ESC ESH recommendations about how to decrease your blood pressures. So a DASH diet, I think everybody knows. DASH diet is dietary approach to stop hypertension. It has a systolic blood pressure change of 8 to 14 mmHg, which is one of the highest. So diet is highest alongside weight reduction, which can help us in 5 to 20 mmHg decline in the blood pressure. So which has the highest effect on the blood pressure? It is diet and exercise, which everybody knows. Diet and exercise is everybody knows that is the most important changer points in hypertension. Alcohol beta, it does decrease the blood pressure 2 to 4 mmHg. Salt reduction or sodium reduction, 6 gram of salt or 100 milliequivalents per day of sodium, it below that it helps in reduction of blood pressure and physical activity more than 30 minutes, and that is again a 4 to 10 mmHg decline in the blood pressure. So weight reduction and DASH diet, this has the highest effect on blood pressures. So if we talk about the primary prevention and secondary prevention, as Naman Misri has also requested, primary prevention, secondary prevention. Primary prevention for hypertension beta, it can broadly be classified into two types. You can either have a population strategy or a high risk strategy. This is you can say a 5-star MCQ because it has been asked multiple times in your exam. So the primary prevention beta, it is 6 grams. WHO says it is 6 gram. बस यही याद रख लो. Government of India में ठीक है, some books might be saying 5 grams salt, but WHO and European Society of Cardiology, European Society of Hypertension, they recommend 6 gram, less than 6 gram. So ठीक है, some people might be saying 5 grams also. Some books are actually saying 5 grams, but WHO recommendation is for 6 grams. So the primary prevention beta, it can be broadly classified into population strategy and high risk strategy. Population strategy is nutrition, weight gain, all these things. High risk strategy is family history. In case there is a family history and tracking of blood pressure, these are coming under the high risk strategy preventions. And then is secondary prevention, early diagnosis, treatment. All these are types of secondary prevention. Okay. So coming to the next MCQ. For a baby exposed to HIV, which of the following is not recommended? What do you think is not recommended? Give nevirapine for 6 weeks, zidovudine if the mother was taking nevirapine. Give nevirapine and zidovudine if the mother is ART insufficient. Breast milk should be given for 6 months and then shifted to cow milk. What do you think is the best answer? I think everybody knows this. Absolutely correct, beta. Absolutely correct. So when we say, this is again an important topic, it is a 10-star topic. So a child who is exposed to HIV, a child who is exposed to HIV, what do we do? A child who is born to HIV mother, beta, listen very carefully, you already know this, I'm just trying to help you recap and revise. So child who is exposed to HIV, beta, immediately what are we going to do? We are going to ask the child whether the child is low risk of transmission or the child is high risk of transmission. When do we say high risk of transmission? High risk of transmission if the mother viral load, it is more than 1000 copies per ml, or if the mother was taking ART of less than 4 weeks. Never taken ART, not on ART, or ART less than 4 weeks, it is called as a high risk mode of transmission. In case of low risk mode of transmission, opposite of this. So if the mother viral load is less than 1000 copies and if the mother is on ART regime. So in case the child is a low risk of transmission, what do we need to give? We give the nevirapine to the child. Nevirapine is to be given for 6 weeks. Okay. Nevirapine is to be given for 6 weeks. In case of high risk of transmission, we have to now ask the mother that, madam, are you going to do breastfeeding or no breastfeeding to the child? In case the mother says, I will do breastfeed, or in case the mother says, no, I will not do breastfeed, or I will give replacement feed. So no breastfeed means replacement feed is given. Replacement feed is to be given to the child. So in case of breastfeeding has to be done, now we give the nevirapine plus zidovudine combination. This has to be given for 12 weeks. In case the breastfeeding has to be given. In case the no breastfeed is there, the replacement feed is there, again same answer, nevirapine plus zidovudine has to be given. This is to be given for 6 weeks. So please note, we give the nevirapine and zidovudine in both the scenarios, that is dual regime has to be given. So in case there is a replacement feed, nevirapine zidovudine to be given for 6 weeks, otherwise it is for 12 weeks. Sir, unknown viral load would be definitely high risk. Definitely it is high risk. If the mother has not been diagnosed with HIV, like had been earlier, and just on the labor table only we come to know that she was HIV, so it is coming under the high risk mode of transmission. So please note that also in certain scenarios, we can give zidovudine to the mother if the mother was taking nevirapine based regime. We can also give zidovudine to the mother if the mother was taking nevirapine based regime. This is also true, beta. Because actually what I'm trying to tell you is that nevirapine, it may have something called as archived resistance. So if the mother was taking nevirapine, then you give nevirapine to the child to prevent HIV, it doesn't work actually. So you have to replace nevirapine for the child with zidovudine. So option B is true. Give nevirapine for 6 weeks, true. Nevirapine and zidovudine if the mother is ART insufficient, this is also true. Breast milk should be given for 6 months and then shifted to the cow milk is not recommended. Shifting of milk is not recommended. Shifting of milk is not recommended. But as far as the breastfeeding guidelines are there, if we talk about the breastfeeding guidelines, you have to see whether the child is HIV negative or the child is HIV positive. If the child is HIV negative, we recommend that the breastfeeding should continue for at least 1 year. If in case the HIV positive child is there, we recommend breastfeeding should continue for 2 years. This is not exclusive breastfeed. It is that the mother's feed breast milk should continue for 2 years if the baby is already HIV positive, because breast milk is the most safest, economical and hygienic and a very rich source of the nutrients. So this is what is the breastfeeding guidelines. Sir, can you explain the HIV diagnostic guidelines in the neonate? Yes, definitely. As the child is born, beta, as the child is born, as the child is exposed to HIV, child born, we give the nevirapine or we give nevirapine plus zidovudine prophylaxis. This has to be given for 6 weeks or 12 weeks. Just now we discussed this now. Just now we discussed this, whether the mother is breastfeeding or no breastfeeding. So now what do we do after this? Very simple. What do? We send the child for the early infant diagnosis, EID. Early infant diagnosis. This early infant diagnosis can be done only after 6 weeks. It is done only after 6 weeks of birth. And this, what is the investigation of choice? Investigation of choice is HIV, TNA, RT-PCR. What do you mean by TNA? TNA stands for total nucleic acid. Total nucleic acid. That is the investigation of choice, HIV, TNA, RT-PCR. If the child is HIV, TNA, RT-PCR positive, it is HIV. If it is negative, it is normal child, and we have to keep the child as follow-up. So in case after HIV, TNA, RT-PCR, in case the child is HIV positive, you start the HIV treatment. In case it is HIV negative, then you do 6 monthly follow-up. This is usually 6 monthly follow-up is usually carried on up till 2 years, and we keep on doing the HIV, TNA, RT-PCR because of the window period of HIV and things like these, right? That is the diagnostic guideline for HIV. Another MCQ which may be asked, I don't know if it will be asked or not. How do you monitor HIV? Like, how do you check for assess the response for HIV? What is the investigation to assess the response for HIV? Anybody who can answer in the group? How do you assess the response for HIV treatment? Do we do CD4, P24, viral load, or anything else? Anything else, like, or do we do rapid test, antigen test? What do you think is the best answer? What do you think is the best answer? P24 is not to assess the response of ART. P24 is incorrect answer because P24, the only MCQ which can be asked on this beta is P24. It is the first investigation. It is the first investigation to be positive in HIV. It is the earliest to be positive in HIV, but there are issues with false positive, false negative. So P24 may be used during the window period. P24, it is the earliest investigation to be positive. So most of you are saying CD4 and almost equal number are saying viral load. So I'm happy for you guys. At least you guys are picking at least out of the right answers. CD4 and viral load both are correct, beta. Assess the response of ART, both are correct. But if you are still getting an examiner like me who is troubleshooting you, so in these cases viral load is always considered as a better answer than CD4 count. Viral load, because directly you assess the viral load. We have something called as a UU campaign. You have heard about this UU campaign? Can anybody in the group write about this UU campaign? What is it for? UU campaign. Anybody in the gang who can think about UU campaign? What do you think about UU campaign? Any idea? UU campaign is yeah, it's a campaign which has been launched by the government of WHO. It has been launched by WHO. It is called as the UU campaign. It means undetectable, means untransmittable. Undetectable means untransmittable HIV. So if somehow the people government makes people as undetectable HIV, undetectable HIV. So if the virus in your body, in the patient's body becomes undetectable, and then that patient obviously will become untransmittable. This is labeled as a UU campaign. It has been launched for HIV prevention. So it's something like a new thing for you guys. But anyways, like I don't want to load you with newer stuff. But that is what is UU campaign, and this gives you a hint that viral load is a better answer. I have a small doubt given by Sandeep Muddy Reddy. Sir, in pediatrics, sir told that breastfeeding exclusively for 6 months and tapered over 6 months stopped after 12 months. Which one to follow? Please note, breastfeeding, Government of India says breastfeeding in patients who are HIV positive, it should be continued for as long as possible, at least for 2 years. Okay, as long as possible, at least for 2 years. I think this is the guideline which you have to follow, because this is Government of India guidelines. It is not IAP guidelines. So this is Government of India guidelines. This should be followed. So which of the following is the best answer you would like to mark? Breast milk given for 6 months and then shifted to cow milk is the wrong answer. So coming to the next MCQ, which of the following is not correct for BOPV? What do you think is the best answer? Which of the following is not correct for BOPV? क्या बोलते हैं? If you do this also wrong, it will be very bad. ये तो simple question है, absolutely correct. BOPV. When the MCQ says it requires minus 20 degrees Celsius for long-term storage, how can it be freeze sensitive? How can it be freeze sensitive? It is a heat sensitive vaccine. Heat sensitive vaccine. Beta, I wanted to talk to you regarding cold chain. Regarding cold chain, एक question आता है in cold chain that there are day carriers. You must have heard vaccine carriers. We have as the vaccine carriers. है ना? We have the vaccine carriers. Then we have as the cold boxes. Then we have ILR. Then we have deep freezer. And then we have walk-in cold rooms. I hope you know this. Vaccine carriers, cold boxes, ILR, that is ice lined refrigerator, deep freezers, and WICR is walk-in cold rooms. Walk-in cold rooms. Okay. So my question is very simple, that in vaccine carriers, you can store the vaccine for how much time? Or in cold boxes, you can store the vaccine for how much time? In these both things, we can store the vaccine for up till 24 hours. Okay. The vaccine carriers will carry how many vaccines, how many vials they can carry? They can carry roughly around 16 to 20 vials. And they will have ice pack. How many ice pack? 4 ice pack. On the same principle, the cold box, if you see, they will carry roughly around 75 to 300 vials, and they will have 16 to 20 ice packs. Okay. Another MCQ is, which vaccine is kept in the top shelf of the ILR? Which vaccine is kept in the top shelf of ILR? Any idea? Which vaccine will be kept in the top part of ILR? Top of ILR. It is always no vaccine. It is always diluents. Below diluents, yes, you guys are correct. I was waiting for this answer. It is hepatitis B. which is kept in the bottom part, which is kept in the bottom part, which is kept in the bottom part, beta. Bottom part is always measles rubella, and followed by that is OPV. OPV is the most bottom part. So measles rubella and OPV, they both are kept in the lower part. OPV is absolutely, you guys are correct, is OPV. But what point I wanted to, still I have not asked the question which I wanted to tell you over here, ask you over here in cold chain, beta, which vaccine will be kept in the deep freezer? Which vaccines will be kept in deep freezers? What do you think? Which vaccines will be kept in the deep freezer? So, which vaccines to be kept in the deep freezer? OPV and BCG. Okay. That is what I wanted you to understand. There are 3-4 types of MCQs which can come. Okay. Very good. So there are 3-4 types of MCQs which can come. Beta, what is the temperature of cold chain? I just want you to understand, not blindly answer whatever you guys read from Q banks or things. Understand the question also, because there can be some examiner who will innovate in the MCQs. There can be some innovation also in the MCQs. So I have to prepare you for that also. Beta, what is the temperature? It is 2 to 8 degrees. So if the temperature of cold chain is 2 to 8 degrees, why, listen very carefully, if the temperature on cold chain is 2 to 8 degrees, why on earth would you place a vaccine OPV in a deep freezer? Are you getting my question? Are you getting my point? Cold chain is 2 to 8 degrees. Then when I ask you which vaccine to be kept in deep freezer, how can you place a vaccine in a deep freezer? Because the temperature is 2 to 8 degrees and deep freezer will be much below 0 degrees. So please note, if the MCQ says which vaccine is kept in deep freezer, answer is no vaccine. If you get this question that which vaccine to be kept in deep freezer, answer is no vaccine. So what is the use of deep freezer? Ravi Mandal says it is for long-term storage. Wrong answer, beta. I want you to understand deep freezers is not for long-term storage also. No, Virender, it is not for long-term storage. Deep freezer yaar itna bada hota hai. It is like, I don't know, I'm not fitting. The deep freezer is not fitting in the screen also. So deep freezer long-term storage के लिए नहीं है. It is not for long-term storage. Deep freezers में there is no vaccine which has to be kept, and it is not for long-term storage. It is only and only for ice packs. Yes, you are correct. It is only and only for ice packs. Deep freezers, where are they located? They are usually at CHCs or PHCs. So why would you keep vaccines for long-term storage in CHC, PHC? So it is not used for long-term storage. It is not used. No vaccine is to be kept. It is only for making ice packs. अगर deep freezer नहीं होता, if there was no deep freezer in this whole game, then where or how on earth would you prepare the ice packs? ना ice pack कहाँ बनाते ना? Ice pack, where will you make ice pack? वो कहाँ बनाते मतलब कहाँ बनता? जगह ही नहीं है आइस पैक बनाने का अगर if the deep freezer was not there. So deep freezer is given in the peripheral immunization cold chain. Why? To make ice packs. Okay. Very nice. Ayan Mandal has got it right that walk-in cold rooms, they are for long-term storage. So there are 2-3 MCQs. Now another MCQ which comes over here. So another MCQ which comes over here. Please note that the vaccine, that is OPV vaccine. OPV vaccine, beta, it is the most heat sensitive vaccine. It is most heat sensitive vaccine. And you, during outbreaks, this is the only exception. OPV is the only exception which during outbreaks or during pulse polio campaigns, we can put this in the deep freezers because we have so many vaccines. So ILR भी भर जाएगा तो ILR के बाद आप वो कहाँ रखेंगे OPV vaccine? It has to be kept in the deep freezers. So only in certain cases, only during outbreaks or during campaigns we can put OPV, and that's the reason you have told me that which vaccine to be kept in deep freezer. Answer is OPV. But if the option says no vaccine, you have to mark no vaccine to be kept in or deep freezer. Please note, no vaccine to be kept. OPV is only under certain conditions placed in deep freezers. Okay, so I hope you get this question right. I hope you get this question right. Okay. Okay. uh, एक और सवाल आता है दैट विच वैक्सीन इज टू बी केप्ट ऑन द आइस पैक्स. सो during immunization sessions, the ENM or the MPW female was there and she took this ice pack. This is the ice pack and there are holes on this ice pack. Which vaccine to be placed on the ice pack? On the ice pack. Which vaccines to be placed on the ice pack? What do you think? Very nice. So on the ice pack, we can place OPV, we can place BCG, we can place measles rubella, we can place rotavirus. But which vaccine is never placed on ice pack? Never placed on ice pack. It is hepatitis B and DPT and pentavalent and PCV. They are never placed on ice packs. Okay, they are never placed on ice packs. So this is kind of important points for you guys. Absolutely correct, beta. Which of the following is not correct for bivalent OPV? It is most freeze sensitive. It is most freeze sensitive. So coming to the next MCQ, which of the following is not correct for National Iodine Deficiency Disorder Control Program? एक क्वेश्चन आया था नमन मिश्री सर, अकॉर्डिंग टू माइक्रो प्लेग वैक्सीन इज लाइव बट अकॉर्डिंग टू PSM इट इज किल्ड, विच शुड बी फॉलोड? देयर आर डिफरेंट टाइप्स ऑफ वैक्सीन्स फॉर प्लेग. We were using a live vaccine, but now we are shifted over to the kill strain. It is a half kind vaccine, but anyways, you can mark anything. A plague vaccine, nobody is going to ask you because it is not used at all. Iska batao, what do you think is the best answer? Which of the following statement is not correct for National Iodine Deficiency Disorder Control Program? Which of the following is not correct for National Iodine Deficiency Disorder Control Program? So I think everybody is answering correctly. It is option D. Goiter rate is a sensitive indicator for environmental iodine deficiency. If you recall, beta, these are your indicators. These are your different indicators we have. So long-term impact indicator, it is always given by, long-term impact is always given by the goiter rate. Long-term impact indicator is always given by the goiter rate. Principal impact indicator you have to memorize. It is a 5-star MCQ frequently asked in your exam. Principal impact indicator is urinary iodine excretion rate. Principal impact indicator is urinary iodine excretion rate. Process indicator is iodine in household salt. That is the process indicator. And the neonatal hypothyroidism rates is environmental iodine deficiency. Environmental iodine deficiency is given by neonatal hypothyroidism rates. It is a 5-star MCQ frequently asked in your exam. Which of the following is the impact indicator, which is process indicator, and things like these. So coming to the next MCQ, all of the following are correct statements except. So what do you think is the best answer? Culex has longest flight range. Aedes is endophilic. Anopheles larva does not have siphon. Culex larva is attached to the roots of the plant. What do you think is the best answer? Mosquitoes, everybody understands, everybody knows that. Yeah, absolutely correct, beta. All are correct statement. Please note we have these few mosquitoes and very frequently we get questions on these. You have Anopheles, Culex, Aedes and Mansonia. So clean stagnant water is for which water? Anopheles. Large water body with aquatic vegetations. Large water body with aquatic vegetation, that is Mansonia. Single eggs, boat-shaped eggs with lateral floats, that is Anopheles. Single eggs, cigar shape, that is Aedes, and cluster eggs are in Mansonia as well as Culex. Attached to the roots, you can see over here, attached to the roots is Mansonia mosquito and not Anopheles. Surface feeder, it is very close to the surface, that is Anopheles, and bottom feeders is both Culex and Aedes. So please remember the sitting posture of these mosquitoes can be asked. This option A, that is Anopheles mosquito, it is always in inclined position, okay, and it has spots on wings. If you look at the next mosquito, that is the Aedes mosquito, it is always parallel to ground, parallel to surface. It is parallel to surface and it has stripes on the body. Coming to the next one, that is the Culex mosquito. Culex mosquito is always sitting in hunchback position. That is, the tail is down and the head is also down. The tail is down and the head is also down, and it is a brown color small mosquito. Small mosquito, brown color, but it has big wings. It has big long wings. The wings are the longest. Whereas the last one, that is Mansonia mosquito. Mansonia mosquito, it has long legs and large body mosquito, and it is sitting in a squatting position. You have to memorize this. Please remember that if in your exam, I don't think they'll directly show you images like these ones. They may or may not. So, but always remember, head is never going to give you the answer. What I want to say is that if the mosquito head is always down, head will always be down. The head will always be down. Okay. If the tail is up, beta, tail. If the tail is up, remember tail is up, Anopheles. Up, remember up, Anopheles, anus up. Okay, Anopheles. If the tail is parallel, remember it is Aedes. If the tail is down, remember it is Culex. Okay, it is the tail which is going to give you the answer. Head will always be down. Don't look at the head, look at the poonch, look at the tail. Look at the tail part of the mosquito. If the tail is up, it is Anopheles. If the tail is parallel, it is Aedes. If the tail is down, it is Culex. Okay, so isko is tarah se yaad rakho and you'll never make mistakes. So Culex has the longest flight range. Yes, this is the correct answer. Aedes is endophilic. Yes, Aedes causes dengue and Aedes transmits dengue, and yes, it is inside. Anopheles larva does not have siphon. Yes, because it is near to the surface. It is near to surface. And because it is near to surface, therefore there is no point of siphon. And Culex larva is attached to the roots of the plant. It is not the Culex larva. It is the Mansonia larva which is attached to the roots of the plant. Okay. So let's go to the next one. What do you think is the best answer? A 23-year-old student who is a known case of SCID comes to your OPD with a history of bite by the neighbor's pet cat while playing with the cat. There is a laceration wound on the wrist of the right hand without blood oozing. The cat is fully immunized for rabies. The next best step is... What do you think is the best answer? It is what category of the bite? There is a laceration wound and without blood oozing. There is no blood oozing. Laceration wound without blood oozing. So this is category A, B, or C. Okay. What do you think is the best answer? Just a moment, I think. Yeah. So, a 23-year-old student with known case, category A, answer is B. Hola Bola says category A, answer is B, I think. Okay. You think answer is B, seriously? C? Beta, it is, I think I'm getting confused or you guys are getting confused. Try to answer me in category 1, 2 or 3. Stop saying A, B, C because that is confusing us with the options, okay? So category B and answer is B. Most of you are going with, okay, it's category 2 or category 1. There is laceration. यार रेबीज अगर आपको नहीं आता तो हाउ कैन यू सर्वाइव रेबीज? होला बोला लाइव वैक्सीन इज कॉन्ट्राइंडिकेट. हाँ, ये तो एम्स का ओल्ड एमसीक्यू है. लाइव वैक्सीन इज कॉन्ट्राइंडिकेटेड इन SCID. Okay. See, beta, I think category wise you identified, but your answer is wrong. So answer is wrong, beta. These are the different categories of HIV. Sorry, not HIV. These are the different categories of wound management. These are the different categories for wound management. है ना? So if you can see the categories over here, if you can see the different categories over here, we have the category 1, bache. Category 1, that is simple licks, touch on the intact skin, and only wound management has to be done. In case of category 2, there could be abrasions or lacerations without bleeding. This is pretty important that there has to be without bleeding, without active bleeding, no blood oozing, no blood oozing. But there is loss of the tissue continuity, of the skin continuity. So in those cases, we have to do wound management with anti-rabies vaccine. In case of deep tissue injury, loss of tissue, blood oozing, active bleeding, wound management plus ARV plus rabies immunoglobulin has to be given. Okay. So this patient comes in what category, beta? First, you have to identify the category. Very simple. So this patient is coming in category 2. This patient is a category 2 animal bite. Okay. So this is animal bite. Acha, one point over here, I think many of you already must be knowing that licks and touch on mucosal surface, that is also category 3 bite. That is also category 3 bite. Okay. So now the point over here is you guys were giving wrong answers. Why? Because category 2 mein no ARV is required, so it's not the option. Now you have to give ARV. So option A is absolutely false. ये तो point खत्म हो गया. Option A is false. Wound washing with antiseptic. Do you use antiseptic? Do you use antiseptic, and that also for 20 minutes? You will spoil the whole skin or the surface of the patient. So please note how to do wound washing, wound management. So wound management, we have to wash with water and soap at least for 15 minutes. It's not 20 minutes. It is for 15 minutes. Wash with running water and soap. No, it's not no soap, Sakshi. There has to be water with soap and for at least 15 minutes. And no antiseptic needs to be applied over here. No antiseptic needs to be applied. So antiseptic is not there and 20 minutes is incorrect. So therefore option B is also false. Okay. So give, acha, Sakshi says yes, I meant water and soap. So next is give ARV complete schedule. So yes, this patient is category 2 bite. We have to give ARV complete schedule. We have to give complete schedule, that is correct. But look at the fourth option. Give ARV with rabies immunoglobulin. With rabies immunoglobulin, it has to be given in category 3. But now the game point over here is that did you read carefully that this patient says that this patient is a known case of SCID. That was the game changer point over here. The stress of the question was not about the categorization of rabies. The stress of the question was categorization of the rabies in what patient? It is in immunocompromised patient. It is immunocompromised patient. So immunocompromised patient, that is immunosuppressed. SCID is severe combined immunodeficiency. So in case of immunosuppressed patient, immunocompromised patient, please note that in case of immunosuppressed individuals, long-term steroid therapy, rabies immunoglobulin is recommended for both category 2 and category 3. This is the learning point for you guys. That was the learning point for you guys, that in case of immunosuppressed individuals or immunocompromised individuals, please make sure that we give rabies immunoglobulin to both the category 2 and the category 3 animal bites. That was the main question. I think you have understood where the game point lies. So this question was not about categorization of rabies and giving ARV. It was about categorization and rabies treatment or management in what patient. This patient is in case of SCID. Sir Ravi Mandal, beta, it's not a live vaccine. We don't use live vaccines in rabies. So rabies are all cell cultured vaccine, and they are put under killed vaccine. They are cell cultured killed vaccines, and they can be given. Rabies is 100% fatal, na? Why would you take the chance of not giving a vaccine? Pregnancy, is it a contraindication for rabies? No, pregnancy is not a contraindication. Okay. So please remember that this is the rabies schedule. If you want to quickly remember or revise the rabies regimes which are there. So how many days do we give re-exposure vaccine for? How many? Let's fill this column first. How many days we are giving rabies re-exposure? We give on day 0 and day 3. Okay. And pre-exposure, beta, when do we give? Pre-exposure is given on day 0, day 7 and day 21 or 28, any day. Day 0, day 7, day 21 or 28. In Thai Red Cross regime, that is a post-exposure prophylaxis, we give it on day 0, 0, 3, 7, 14 and 28. So we give 2 doses every time. 2 doses every time. And no dose on 14 and 2 doses on 28th day. So day 0, 3, 7 and 28. And this is SN regime. SN regime is day 0, 3, 7, 14 and 28. So day 0, 3, 7, 14 and 28, that is for SN regime, and it is 1 dose every day. So how many visits would the patient come, beta? Re-exposure, patient will come for 2 visits, pre-exposure for 3 visits, Thai Red Cross for 4 visits as you can see over there, and 5 visits for SN. You can remember this by the number. RE has how many alphabets or how many letters, beta? RE, R and E. Pre-exposure has how many alphabets? P, R and E. Thai Red Cross has how many alphabets? T, H, A and I. SN regime has how many alphabets? E, S, S, E and N. So these are the number of visits. Then if we talk about the number of doses. So number of doses. Rabies schedule given by my classmate's father. He received Padma Shri. Oh, what was his name, Aditya Rana? Very nice, interesting, very nice. Thanks to all the scientists and thanks to all the people who are working for rabies and for all the diseases for that matter. Dose, beta. What is the dose? This is given. How many doses? 2 doses are given, and it is given, it can be given as intradermal or it can be given as intramuscular. 3 doses, 3 visits, intradermal, or we can give it as intramuscular. Thigh is 8 doses, it is always given as intradermal, and SN is 5 doses, it is always given as intramuscular. Dr. Umesh Bharti. Oh, okay. Very nice, very nice. So this is what is rabies, and this you have to remember and you have to memorize for your exam. Please note rabies immunoglobulin. This can also be asked in your exam. Rabies immunoglobulin should be given within how much time? Rabies immunoglobulin should be given within 7 days of exposure. Rabies immunoglobulin should always be given within 7 days of exposure, and rabies immunoglobulin is not recommended with re-exposure prophylaxis. It is not recommended with re-exposure prophylaxis. It is usually given once a lifetime. It is once a lifetime. Yes, monoclonal antibodies are also there for rabies beta. We have this rabies shield as the SI2 RMAB. These are the monoclonal antibodies. Monoclonal antibodies we have as a rabies shield, and we have S2 RMAB, recombinant monoclonal antibody S2. So these are the monoclonal antibodies. They replace rabies immunoglobulin. They are not in addition to immunoglobulin. They replace the immunoglobulins. So anyways, that's enough for rabies. Too much of rabies. What is the best answer over here you would like to mark? Because this child is SCID and therefore we are going to give rabies immunoglobulin along with the anti-rabies vaccine. Coming to the next MCQ beta, which of the following is not a part of the indirect mode of transmission? Fatafat, fast. Let us take on the next MCQ. Just maybe 5-7 questions more remaining. That's all. Which of the following is not a part of the indirect mode of transmission? हे इसमें भी तुम लोग डिफरेंट आंसर्स दे सकते हो. इसमें भी तुम लोग गलत आंसर दे सकते हो. Yeah. Now I think everybody is answering correctly. Which of the following is not a type of indirect mode? So cyclodevelopmental transmission, droplet nuclei, contact with soil, waterborne diseases. So absolutely correct beta, absolutely correct. You all have answered. Most of you had answered correctly now. So earlier some said B or D also. Please note, it is correct answer is absolutely correct, contact with soil. It is a part of the direct mode of transmission. Contact with soil transmitted, it is direct. Absolutely correct, very nice. So you have the direct mode of transmission, indirect mode of transmission. Droplet, please remember, is direct. Transplacental is direct. Inoculation, that is bites, it is direct. And direct contact is touch, and soil contact is through soil transmitted. Indirect could be vehicle borne, vector borne, airborne, fomites, and unclean hands. Let us go to the next MCQ. Which of the following is a correct statement for ankylostoma duodenale? A question from microbiology probably. But anyways, which of the following is correct statement for ankylostoma duodenale? What do you think is the correct answer? Okay. Some say A, D, B, D. माइक्रो का क्वेश्चन है वैसे तो. This has been asked multiple times in your exam, and it is a very frequently asked MCQ. Ankylostoma duodenale, this is the hookworms. It is a 5-star MCQ. Okay, most of you are saying option B. Most of you are saying option B. Okay. Look at this, beta. This is a table. You can take a screenshot of this because these videos will not be available after your NEET exam. So make sure you get this right. You can see this table. I have made this as a table as Escherichiasis and Ankylostoma, that is the hookworms. Okay. The hookworm, the mode of transmission. Okay. Try to understand the point over here. Hookworm, that is Ankylostoma duodenale. Hookworm, beta, the mode of transmission, how does it spread to people? The people will release, the person who is reservoir of hookworm, he will release the eggs from the feces, from the stool. So now the egg is going to egg from feces. It will hatch in 1 to 2 days and the infective larva is ready in 5 to 10 days. You have to memorize this, that who is the infective form? The infective form of Ankylostoma, it is infected larva. The larval stage is the infected form. Infective material is the larva. Okay. And how does it transmit? It transmits via inoculation. It transmits via a penetration through the skin. Once it goes inside the skin, it will stay inside the body for 1 to 4 years. And therefore, it will cause that larva migrants and all these things. This is most common associated with chronic blood loss also. With chronic blood loss, and open air defecation is the most important factor, and barefoot walking in the fields is again important factor. So the infected larva will penetrate the skin and then cause the hookworm disease. On the other hand, if you look at Escherichiasis, eggs come from the feces and the eggs become infected. So the embryonated egg itself is the infective material. So now infected egg will not enter through the barefoot walking. Infective egg will enter through unclean hands, through ingestion mode. It is not through inoculation. It will stay inside the body for 1 year approximately and will cause this Escherichiasis. It is the most common helminthic infection. But the most common overall, it is Escherichiasis, but most common to be associated with anemia. With anemia, that is Ankylostoma. This is pretty important. Whatever I have highlighted, they have been asked multiple times in your exam. Another point is Escherichiasis. Just remember, it is because of the eggs, and Escherichiasis will release 2 to 3 lakh eggs per day. It is huge amount of eggs per day. And the Ankylostoma and the Necator americanus, they release 10 to 30,000 eggs per day. But huge amount, 3 lakh eggs and 30,000. 30,000 and 3 lakh eggs. So that is important for you guys to understand, that Ankylostoma is releasing lesser number of eggs, but the larva is the infective form. And because larva is the infective form, common sense, larva, just somehow related, that larva, it will need what type of soil, beta? Larva, will it be there on a hard soil, or the egg has to hatch into larva, na? So the soil has to be very soft and porous and sandy soil. Whereas on the Escherichiasis side, the soil which is hard and clay, because the egg just needs to embryonate. The egg itself is the infective material. So the hard clay soil is for Escherichiasis, soft porous soil where the egg needs to hatch into the larva. Therefore, the soft porous soil is related to Ankylostoma duodenale. So overall, 2-3 points for you to remember. Lesser number of eggs for hookworms. Hookworms are lesser number of eggs. They are transmitted by inoculation of the infected larva, and larva needs a soft porous soil and it stays inside the body for 1 to 5 years. On the other hand, if you want to remember for Escherichiasis, the egg is the infective form. The soil is hard clay soil. They come inside the body via ingestion mode and they stay inside the body for approximately 1 year. And they release 200,000, like 2 lakh to 3 lakh eggs per day. So this is pretty important for you guys to remember. If you understand this, so it lays ankylostoma. It lays 2 lakh eggs per day. It is false answer. It is not 2 lakh. Damp sandy soil is preferred for larva survival. Damp and sandy soil. Yes, this is true. Lifespan is 6 to 12. This is false. Embryonated eggs are infective stage. This is also false. So which is the correct answer? Most of you were correct. It is option B is the best answer to be marked in your exam. Option B is the best answer to be marked in your exam. Okay. So 2 lakh eggs is for Escherichiasis. We are talking about hookworm disease. Very nice, very nice. So let's go to the next MCQ. Just few points. Maybe 1, 2, 3, 4, 5, 6, 7. 7 MCQs remaining. Which of the following is not correct regarding cholera epidemiology? Which of the following is not correct regarding cholera epidemiology? What do you think is the best answer? What do you think is the best answer? Chronic carrier stage in cholera is most responsible for propagation of outbreaks. 75% of cholera infections are asymptomatic. Dukoral is monovalent while Sancol is bivalent vaccine. Mass chemoprophylaxis is not recommended. Which of the following is not correct? Okay, you have to find the not correct one. Okay, so we have different answers. We have option B. Many students are giving option B. Nilakshi, इतने close options. I don't think these are close options. ये इतना मतलब इनका कोई रिलेशन ही नहीं है आपस में. They are not at all close, है ना? They are not related. एक मैंने वैक्सीन का डाला, एक ये सारे MCQs बेटा फ्रेशली प्रिपेयर्ड है. आई एम वेरी प्राउड टू से ये क्वेश्चन आपको कहीं नहीं मिलेंगे. These are all new MCQs. I am exposing you to new MCQs. That is what I feel. कि अगर पुराने क्वेश्चन मैंने ही आपको मैरो वाले क्वेश्चंस या किसी और ऐप वाले क्वेश्चंस पढ़ाने थे, देन मेरा कोई फ़ायदा थोड़ी ना. वो तो सब लोग करवा ही रहे हैं. ये सारे नए बेटा अभी रोटी पक के आई है, अभी आटा गूंदा है, एंड दिस इज़ ऑलरेडी डिनर टाइम है ना. सो बात भी उसी की हो रही है. फ्रेश अभी आटा बना है और फ्रेशली बेक करके आपको मिल रही है चीज़ अभी. क्वेश्चन से डर नहीं लगता, ऑप्शन से लगता है. Which of the following is not correct regarding cholera बेटा? Chronic carrier stage 75%, Dukoral is monovalent, mass chemoprofile है. देखो बड़ा सिंपल MCQ है बेटा, बड़ा सिंपल MCQ है. जो कॉलरा के सबसे पहले तो यही पता होना चाहिए दैट व्हाट इज कॉलरा. कॉलरा इट इज बाय विब्रियो कॉलरे. ओके, सो विब्रियो कॉलरे में जो कॉलरा आएगा, कॉलरा का कैरियर स्टेज इज वेरी वेरी इंपॉर्टेंट. You can have different carrier stages: incubatory carriers, convalescent, healthy carriers, chronic carriers. Okay, the incubatory carriers, convalescent carriers, they will be showing within 1 to 5 days. Convalescent carriers 2 to 3 weeks. Healthy carriers कौन से होते हैं? Who are from subclinical stages, and chronic carriers who will spread for roughly 3 months or more. Okay. So please note, healthy carriers and chronic carriers, they maintain the infection, during inter-epidemic phases. So when there is no epidemic, they maintain, who is going to maintain infection in the community? The chronic carriers or the healthy carriers, they keep on maintaining infection. They keep on spreading here and there. People don't get cholera, but the cholera is maintained in the infection. Okay. So maintained in the society or in the community. So therefore, I hope you understand that first option, chronic carrier stage, is for propagation of outbreak. This is itself a wrong answer. It is not for propagation. It does not increase the outbreak. It is not for initiating the outbreak or for increasing the outbreak. Chronic carrier stages are not responsible for propagation of outbreak. Chronic carrier stages are most responsible for maintaining the inter-epidemic phase. Okay. Next is 75% of cholera are asymptomatic. Please note that if we talk about cholera, roughly 70 to 80% are asymptomatic and less than 20% they are symptomatic. And less than 20% are symptomatic. Out of this 20%, roughly 50%, less than 10% will land up into a very severe type of diarrhea or the rice water diarrhea, and more than 10%, they land up into very normal kind of diarrhea. They will get diarrhea, but it is like a self-limiting type of diarrhea. So that is about the cholera type of spectrum of disease. Now, talking about this vaccine, Dukoral is monovalent while Sanacol is bivalent. So many people get this confusion. I also, when I was doing, I was in third year, I also answered it wrongly in the Viva exam. Sir asked me, it was actually not sir, ma'am asked me, like Dukoral is monovalent or bivalent. I also thought Dukoral, though, two, है ना? It comes to the mind Dukoral 2. मैंने कहा Dukoral is bivalent. वो गलत हो गया. Dukoral is monovalent, beta. Sanacol is bivalent. Okay, Sanacol is bivalent, Dukoral is monovalent. Don't do this mistake which I did. So Dukoral लगता है कि दो है. So it's not do. Dukoral is monovalent. It is only one strain, that is the O1 strain. And Sanacol, it is two strain, that is the O1 and O139. The Dukoral, it needs a gastric buffer also, whereas there is no buffer required in Sanacol vaccine. And which one is slightly better off? They both have good efficacy in preventing cholera, but of course slightly better off is the Sanacol vaccine. So Sanacol vaccine, please note, Sanacol vaccine is given as 2 liquid doses 2 weeks apart, and these are given in 2 doses. That is a bivalent oral vaccine, whereas a Dukoral, it is a monovalent oral vaccine. Okay, so if you understand this, Dukoral is monovalent, yes, Sanacol is bivalent, this is also true. And mass chemoprophylaxis is not recommended. Absolutely, mass chemoprophylaxis is not recommended because you already know 70 to 80% of the people are asymptomatic. They will not have any symptoms. So how can you give prophylaxis to people who are asymptomatic? To people who have the infection, how can we give them prophylaxis? So please note that cholera may, the healthy carriers and the chronic carriers, they maintain the infection in the society. And in cholera beta, there is something called as the force of infection. Like if this is the time duration, so the cholera will keep on increasing. Okay, cholera cases, these are the number of cases. Let us say that at one point, the cholera number of cases keep on increasing. Now at one point, let us say you stop the water, stop the contaminated water. Okay, now the source is gone. But the point is that after the source, listen very carefully, after the source is gone, the cholera cases do not come down. They still keep on increasing. Why do they keep on increasing? This is called as the tail of epidemic. Tail of epidemic. And who is maintaining the tail of epidemic? The tail of epidemic is maintained by these convalescent carriers or healthy carriers. They keep on spreading for a certain time and then slowly it will come down. So immediately when we stop the water, that is the first thing which we have to do in cholera outbreaks. You have to stop the water supply. So once we stop the contaminated water supply, even in spite of stopping the water supply, still people will get infection. New infection will still happen. Why does this happen? Because there is something called as tail of epidemic. It is like a big train which is moving on. So even if you apply the brakes, the train will take some time to stop. So please remember, this is what it is about cholera. Cholera, the chronic carrier stage, is not responsible for propagation of outbreak. It is responsible for maintaining the infection in the society. Option A is the best answer. Let us go to next MCQ. Tetanus, very important question regarding tetanus. A person has received complete immunization against tetanus 10 years ago. Now he presents with a clean wound with surgical blade sustained 1 day ago. Which of the following statement is correct? Clean wound, no vaccine. Clean wound, 1 TT vaccine. Unclean wound, unclean wound. What do you think is the best answer? What do you think is the best answer? Most of you are saying option B, but some say option D. And Prem ne bilkul theek hai. Very nice export, and you all have got the game changer point. So it is with a surgical blade. Yes, it is a clean wound, but it was sustained. I think everybody got this. यहाँ पे आपने ट्रिक पकड़ ली मेरी. It is 1 day ago. ट्रिक थी 1 day ago. It was not about surgical blade. It was not about surgical blade. The trick was about 1 day ago. Very nice export and very nice frame. You all have understood. So for tetanus beta, you all have different categories. We have different categories. Category A, B, C, and D. So the completely immunized within 5 years is category A. 5 to 10 years is category B. More than 10 years is category C. Cool person, unknown, never immunized, that is category D. So in clean wound, unclean wound, what is a clean wound? It is with sterile instrument and which comes within 6 hours. Please note, Prem, it is not 4 hours, it is 6 hours. Please note, Prem, it is not 4 hours, it is 6 hours. Unclean wound is any wound which is more than 6 hours, and obviously it is anything which is contaminated. So if the person is already immunized within 5 years, then nothing needs to be done. No TT vaccine, only wound management. 5 to 10 years, you give 1 TT shot. In case of more than 10 years, again you give 1 TT shot with tetanus immunoglobulin. And in case the person is never immunized, unimmunized, you have to give the complete schedule, complete vaccination regime, that is for 2 doses of tetanus toxoid. And unclean wound, again you give the complete vaccination with tetanus immunoglobulin. Complete vaccination with the tetanus immunoglobulin is the correct answer for option D. So what is this patient? This patient has received the immunization 10 years ago, and now he presents with the surgical blade 1 day ago. So this is unclean wound, and 1 TT vaccine has to be given. Unclean wound and 1 TT vaccine has to be given. This is the correct answer. Okay. Coming to the next MCQ, in case of accidental exposure, the post-exposure HIV prophylaxis should be started best within. So the question is, should be started best within how much time? Options are 2 hours, 4 hours, 24 hours, 72 hours. So absolutely correct, beta. If they say the best within, it should ideally be started within 2 hours and not more than 72 hours. So it should be started within 72 hours. But if the question says best within, you have to go with the best answer, that is 2 hours. Okay. Coming to the next MCQ, steps approach include all of the following except. Steps approach include all of the following except physical measurements, blood samples, mental stress index, nutritional and demographic profile. So steps approach include all of the following except. Okay, most of you are going with blood samples. No biochemical test, I think. Hola bola. Exportin says blood sample. Most of you say B. Okay, some say C also. So beta, steps approach, that is for, please remember, what is steps approach? It is for risk factor assessment. It is for risk factor assessment of metabolic diseases. Metabolic syndrome. It is for risk factor assessment of metabolic syndrome. Okay. So please note, it is not for diagnosis. It is just for risk factor assessment of metabolic syndrome. So these are the 3 steps. You look at the 3 steps. Just give me 1 minute. I will be back very soon. Just look at these 3 steps. Read these 3 steps. These are important for your exam. Just give me 1 minute. I'll be back soon. So if you look at these steps approach, beta, you have these steps approach. Please remember, this has been MCQ, that what is the use of steps approach? It is used for diagnosis of metabolic syndrome or just for risk factor assessment. It is used for risk factor assessment. How many steps are there? 3 steps are there. One is questionnaire based. Next is physical measurements, that is height, weight, waist, circumference and everything. And last is step 3, that is for blood samples also. This can be asked in your exam. How many blood samples? Like for what do? We do lipid testing and glucose levels. Lipid testing and glucose levels, and therefore what is the best answer you would like to mark? Nutritional demographic profile, yes. Blood samples, yes. Physical measurements, yes. What is the correct answer? It is mental stress index is not a part of the WHO steps approach. Option C is the best answer. Another MCQ, which 28-year-old pregnant female who is in her 3rd trimester has never had chickenpox. She is exposed to a family member with active chickenpox. What is the most appropriate management for the pregnant female? Common sense answer, simple question, simple answer. What do you think is the best answer? It's a very simple direct MCQ, beta. Please note, in all people who are exposed to chickenpox, post-exposure prophylaxis for chickenpox has to be given. This post-exposure prophylaxis for chickenpox, one we can give is the OCA vaccine. OCA vaccine is given at the dose of 0.5 ml. Intradermal vaccine, it is given in 2 doses. 3 to 6 months apart. It is given in 2 doses, 3 to 6 months apart, 0.5 ml subcutaneous, not intradermal, sorry. 0.5 ml subcutaneous. Thank you. Not intradermal. It is 0.5 ml subcutaneous vaccine, 3 to 6 months apart, 2 doses. OCA vaccine. But you all know that OCA vaccine, it is a live vaccine. And because OCA vaccine is a live vaccine, it cannot be given to pregnant females, immunocompromised, and therefore, what is the other alternative? We can use as the varicella zoster immunoglobulin. Varicella zoster immunoglobulin, it is usually given within 3 to 4 days of exposure, usually within 72 hours. If you get single best answer, please mark 72 hours. Varicella zoster immunoglobulin should be given within 72 hours. OCA vaccine, it can be given within 5 days. OCA vaccine can be given within 5 days. Immunoglobulin should be given within 72 hours of exposure. So what is the best answer? It is common sense answer. Give varicella zoster immunoglobulin. Which vaccine is given as adult dose for diphtheria, beta? Next MCQ, which vaccine is given as adult dose for diphtheria? What do you think is the best answer? DPT? DTaP or TDAP? We also have TD. Some students are answering TD also. TD vaccine or TDAP or DTaP? What do you think? Most of you are going with option C, which is correct answer. Option C is the correct answer. Beta, diphtheria vaccine, it is available in 2 types. We can have a low dose diphtheria or a high dose diphtheria toxoid. So high dose diphtheria toxoid, it is written as capital D. Low dose diphtheria toxoid is written as small d. It contains 2 LF units. LF stands for limits of flocculation. So it is 2 LF units, and capital D, it contains 25 LF units. So that is high dose, and this high dose, it is given for children, whereas the low dose, it is given for adults. And that is the reason for pregnant females, you must have heard that we give, for pregnant females, we give which vaccine? T and small d vaccine. So what is the best answer? I think now it is common sense. We are going to give adult dose. We have to give is the low dose diphtheria, that is the small d. So TDAP is the best answer. Just last 2 MCQs, I think. Which of the following is not correct for cervical cancer vaccine? Which is the not correct for cervical cancer vaccine? You have to find the false one. You have to find the false one. What do you think is not correct for cervical cancer vaccine? Okay, some of you are saying option C. Cervavac is a bivalent vaccine. Gardasil is used for both boys and girls. Cervarix is approved only for girls. Cervavac may prevent genital cancers, anal cancers, and genital warts as well. So which of the following is not correct? You have to find the false one. So this again, cervical cancer vaccines, beta, it is a 5-star. Gynae people may ask you, medicine people may ask you, PSM people may ask you this question. So this is a flashcard for you guys. This is a flashcard for you guys about the cervical cancer vaccines. You can take a screenshot over here, else you can see this MMFC. All these flashcards, MMFC stands for my name and flashcard. All these flashcards, beta, they are also available on the Instagram profile that I have. It is also available on the Instagram profile and you can see and download all the flashcards from there as well. Okay, so on my Instagram profile you can see all the updates, all the flashcards will be available. You can see over here Sarva-Rix vaccine beta. Sarva-Rix vaccine, it is a bivalent vaccine and it is only approved for females and it is not used these days. It has been taken back, it has been pulled back, it is not available, Sarva-Rix vaccine. So it is not used routinely. We have the Gardasil vaccine. Gardasil is of two types. We can have a Gardasil 4-valent, quadrivalent, or we have a Gardasil 9-valent or a nonavalent. So the Gardasil, it is available for both boys and girls. So for both boys and girls, Gardasil can be given. It is for both boys and girls. And it is given in 2 doses or 3 doses. Nonavalent is most commonly used. That is the 9-valent vaccine. So it has all the cervical cancer the numbers, the HPV 6, 11, 16, 18, 31, 33, 45, 52 and 58 number. These are the 9-valent vaccines. And it prevents almost all the head and neck cancers, anal cancers, genital cancers, everything. Most routinely uses Gardasil 9-valent. Now, Government of India, we are very proud to say that the new introduced vaccine, it is a new update, that is the Sarva-Vac vaccine. So this is the Government of India new vaccine, cervical cancer vaccine. It is a very low cost vaccine. It is only available at the rate of 2000 rupees per dose. And so this is like 4,000 for 2 vials are there, 2 doses we can give. So it targets 4 strains beta, 6, 11, 16, 18, which are the most common HPV responsible for cervical cancer. And it is a quadrivalent vaccine. It is L1 protein. Quadrivalent vaccine. It is approved for 9 to 26 years of age and it is given in 2 doses 6 months apart. In case the patient is immunocompromised, we will give it in 3 doses again 6 months apart. So this is about things you have to remember about the Sarva-Vac vaccine. Sarva-Vac is Government of India vaccine, 9 to 29 years or 26 years of age, both for female and male. It is for 16 to 18 as well as for 6 and 11. Genital wart 6 and 11, HPV cervical cancer is with 16, 18. I think you know these numbers. So if you understand all this game, Sarva-Vac is a bivalent. No, that's a wrong answer. Gardasil is used for both boys and girls. This is true. Sarva-Rix is approved only for girls, although it is not used. This is also true. Sarva-Vac may prevent against genital anal cancer. This is also true. I don't know, many of you were marking option D, which is the not correct. Sarva-Vac is a bivalent. That is the wrong answer, and that is what you were expected to write, mark in your exam. Last question to close off the whole topic. 2 hours done. Which of the following is a target in SDG? Last question to close off the topic. Which of the following is a target under SDG? SDG stands for Sustainable Development Goals. Last MCQ for the day and let's close it off. Infant mortality less than 32 per 1000, early neonatal less than 12, maternal mortality less than 70, reduce premature deaths by NCDs by 1/3. What do you think? Which of the following is the target? So option C, almost everybody is going with option C. Very nice. Some go with option B also. हाँ देखा, जोर का झटका धीरे से लगेगा. Most of you are saying option C. Some say option B. एक ने D भी बोला. A भी बोल दो यार, A रह गया. Somebody please mark A also. नहीं, A नहीं करना. हाँ देखा, जोर का झटका धीरे से. आई थिंक एक ने पकड़ लिया मेरे को. यू गॉट द की पॉइंट, यू गॉट द ट्रिक ऑफ द एमसीक्यू. नीलाक्षी, वेरी नाइस. ओके चलो, लेट्स सी. हाँ देखा, अब पढ़ा सबने. अब सबने पढ़ा है कि यार ओ तेरी, तो ये तो रेट लिखा हुआ है, यहाँ तो रेशो लिखा ही नहीं है. अरे यार ये तो गलत हो गया. सो आई थिंक एवरीबडी नोज दिस। ये गेम थी, गेम में आप पकड़े गए और अब आप अपने आप को वो करोगे कि यार गलत हमने जान के किया। सो प्लीज नोट, infant mortality less than 32, this is wrong answer. There is no target for infant mortality. If at all MCQ comes infant mortality less than 25, but that is not under SDG. SDG के अंदर infant mortality का कोई target ही नहीं है. So this is wrong. Okay. Early neonatal of less than 12. It is not early neonatal. It was neonatal mortality less than 12. So ये भी false हो गया. It is not early neonatal less than 12. We need neonatal mortalities to be less than 12 per 1,000 live births. Maternal mortality rate है, ratio नहीं, ratio है, rate नहीं है. So this is also false answer. Reduce premature deaths by 1/3. That is the correct answer by the SDGs target. हाँ, माइंड समवन साक्षी, ये कई दफ़ा होता है स्टूडेंट्स के साथ कि कुछ गलत लिखा हो, वो ऑटो करेक्शन दिमाग में चल रहा है कि यार ऐसे ही लिखा होगा. माइंड समटाइम्स रीड रॉन्ग डिटेल करेक्टिंग इटसेल्फ व्हाइल रीडिंग. वेरी नाइस. यस, आई एग्री टू दिस. सर व्हाट ऑल आर देयर इन एसडीजी? ये लो जी, आपके लिए पेश है हमारा एसडीजी. सो ललिता ने मांगा और ये मिला. कुछ और मांग लेते बेटा कुछ और मांग लेते, वो भी मिल जाता. पता नहीं होता ना किस टाइम पे क्या चीज़ हो रही है. सो आपने मांगा और ये मिला. सस्टेनेबल डेवलपमेंट गोल्स, गोल नंबर 3 विच इज़ हेल्थ रिलेटेड. सो दिस इज़ ऑल्सो अ फ्लैश कार्ड नंबर 2028. So goal number 3 is health related. We want to reduce the global maternal mortality, that is the maternal mortality ratio, to less than 70 per lakh. Then is reduce newborn mortality. It is not early neonatal. We want to reduce the newborn mortality to less than 12 per 1,000 live births. Reduce under 5 mortality to as low as 25 per 1,000 live births. End epidemics of HIV, tuberculosis and all these things, and reduce 1/3 premature mortalities from NCD and promote mental health. So that is where the MCQ was. That is to decrease 1/3 mortality. So 1/3 mortality to be decreased from non-communicable disease. एम्स की सीट मांग लेते सर, दिला देते. यस, हो सकता था. आपने जो मांगा वो आपको मिला. So all the guys who are sitting till now late night with me, ये आपके लिए बेटा SRS अपडेट है, न्यूली लॉन्च डेटा है. एंड काफ़ी हमने इसके ऊपर बात भी किया है that this is the current value, new values which have been released by government of India. So थोड़ा there is changes, otherwise more or less it's almost the same. More or less it's almost the same. Again, this is also available in my Instagram profile, flashcard number 3021, and it is about the SRS update on Instagram. This is flashcard. Yeah. So we talk about the natural growth rate, infant mortality rate currently कितना है 27, maternal mortality ratio current कितना है 93. Then we have as death rate in India, it is 7.5, and birth rate it is 19.3. Right. So with that, I'd like to thank you so much for watching this whole community medicine module with me about the recent MCQs or new things for you guys. And I'm always available on Instagram or Telegram. For any doubts, you are very welcome to put it on the Telegram group. And for all the updates, you can follow this on Instagram. And any doubts if you have, you're very welcome to ask. चलो मुदगिल, वेरी नाइस. आज सच में नई टेक्निक मिली क्वेश्चन को देखने की. सो यही ज़रूरी है कि क्वेश्चन को अलग अलग नज़रिए से देखो कि वट एवर इज़ ऑलरेडी बीन आस्क्ड वो दोबारा मैं पूछ के आपसे क्या करूँगा ना. चलो, थैंक यू ललिता, थैंक यू सो मच. सर इंस्टा बंद है. अच्छा किया इंस्टा बंद है, मेरा भी इंस्टा बंद है. सो या अच्छा है, इंस्टा बंद होना चाहिए यार, बहुत एडिक्टिव है इंस्टा. सो इट शुड नॉट बी, मतलब वर्ड ऑफ कॉशन है. And all those who have stopped using Insta, it is very nice. Sir, Madhukar birthday today. Very nice Madhukar. Happy birthday. But Madhukar, आपके लिए बर्थडे गिफ्ट है कि आप खुद अपने लिए ट्राई टू सॉल्व 100 MCQs. दैट विल बी बर्थडे गिफ्ट फॉर यू. एंड क्या पता, इन योर एग्जाम यू माइट गेट 5 MCQs फ्रॉम दोज 100, है ना. बर्थडे गिफ्ट तब मिलेगा. सो हब एंड स्पोक मॉडल वो नेक्स्ट टाइम करते हैं एक्सप्लेन. हब एंड स्पोक मॉडल दैट इज इन मैनेजमेंट, हेल्थ मैनेजमेंट में आएगा. सर कितना पक्का कर दो पीएसएम का. मुझे पक्का है यार, पीएसएम तुम्हारी, आई टेक गारंटी ऑफ पीएसएम हो जाएगा तुम्हारा, डोंट वरी. चलो, ऑल द वेरी बेस्ट, हैव अ गुड नाइट बच्चे. राइट, नेक्स्ट टाइम कभी किसी और वेडनेसडे पे मिलेंगे, एंड दैट इज टू talk about epidemiology, biostats, and nutrition, environment, कुछ ऐसा classes. Every Wednesday I try to be online, but I'm not sure about the next Wednesday. Let's see. चलो, good night, bye bye.